Jodie McVernon, thanks for joining us. Your report seems more critical now than even when you released it, the report to National Cabinet. Can we talk about a situation where we get to 80% double vaccination and what New South Wales would look like if it had cases in the thousands by then?
So I think it's important to differentiate between what our report is discussing, which is making a transition from a state of no or very few cases into a more immunised environment, and then thinking about how transmission might be managed there, as opposed to coming down off a high caseload. So clearly vaccination is going to be a critical tool to augment the public health response in New South Wales, but our report doesn't specifically address that case.
Okay, well, let's have a look at, say, Victoria or even Canberra. Let's say they can't get to zero. That's probably more akin to your model, isn't it, if they can keep it at, say, 20 cases a day?
Yeah, so certainly we were set up for a situation where caseloads would be small, that any outbreaks would be well managed. Obviously, we were not envisaging shifting from phase A to phase B from a situation of lockdown, which is where we are now. And so I think this ongoing piece to understand how, moving from a high caseload environment through vaccination and how that can help to support the easing of public health measures is a really important parallel piece of work. And as I say, we're working closely with our colleague James Wood at University of New South Wales, who's leading that body of work.
And so is that going to govern how the New South Wales government deal with this once they get higher vax rates in October, that piece of work, is it? Is that the intention? Is it commissioned by New South Wales Health?
It is, and modelling is one piece of evidence that comes into this very complex process of decision making around how to manage an outbreak. We don't tell anyone what to do, but the advice that we give and the insights that we can provide about the situational assessment, what's happening on the ground and how vaccination might support that is one additional element that can really feed into that decision making process and help decision makers think through in these uncertain times what might happen next.
I'm sure all Australians just want an end to lockdowns, and deep down they want to know, or they would be hoping, that at 80% double vaccination we have no more lockdowns. But your modelling didn't find that, did it?
What our modelling found that as vaccination coverage increases, vaccination does much more of the heavy lifting of the public health response. And what we all want, we are all exhausted by this uncertainty. So we completely understand and feel deeply on a personal level that need. What we're saying is the only pathway to that is vaccination, and these overarching thresholds were sort of national aspirational targets. But we're also saying very clearly that unless those targets are achieved at subpopulation level, at small area level, within risk groups, if we have patchy uptake or we have groups who are left behind, then we will continue to see outbreaks. And in that situation, public health response teams will need to do what keeps the population safe. And it's not completely ruling out small, targeted, localised lockdowns as part of public health outbreak response.
Just on that though, what you appear to be saying is we won't have any more of these 6-month lockdowns, hopefully, if we can maintain 80% double vax coverage of the adult population.
Clearly that's where we're going. And I think the brilliant aspect of this piece of work was that it was closely collaborating with Treasury. We provided our best assessments of what vaccine impacts could do. They went away and looked at that in terms of the likely need for interventions. And, on those pieces together, given the incredible cost to our economy of these prolonged lockdowns, basically agreed with us that the best way forward was to keep case numbers low, to wait to reopen until we had these higher vaccine levels that were more effective at preventing the case growth that would need prolonged lockdowns.
What do you think about the suggestion at 50 to 60% vaccination with the current numbers that some restrictions could be eased?
So the work that we did looked at synergies of interventions, and what we showed was that at 50 or 60% to keep an epidemic at this critical control threshold, so where we talk about a transmission potential or a reproduction number of 1, that means that cases won't keep growing up. We know that at 50 or 60% coverage, that you're likely to need moderate or more severe restrictions to keep that level achievable. It may be that in coming out at somewhere between 50 and 60 that a gradual easing from this sort of stage 4, which our modelling of stage 4 demonstrated the impact of Victoria's stage 4 lockdown in 2020. That measures somewhat less than that might be sufficient, but again, it's going to have to be very much an assessment based on risk. And in every epidemic, we look at where cases are happening and what particular groups in society or occupational groups or other things. We know that lockdowns don't proportionately affect everyone because some people still have to go to work and still have to keep our country running.
Your report talked about the fact that when it came to modelling outcomes, having children vaccinated was neither here nor there. Can you talk us through why you came to that conclusion?
Sure, and that's obviously been a very controversial aspect of the modelling that's been picked up. So unlike most other infectious diseases, children play a lesser role than their parents. So it's working age adults who really are the target for this next phase. And by vaccinating those, we get the most value across the whole population in terms of what we can achieve. And that's protection both of elder populations as well as children. That doesn't mean children should never be vaccinated. And as we then move from this phase into the next one, then the next series of questions really will be around making sure that subpopulations who may be under-immunised, either in hard-to-reach areas or groups that are difficult to access services, or children, how do we then reprioritise this next phase to make sure that we achieve maximal population coverage? And we're all aware that we're seeing infections in children. In the UK, we're seeing outbreaks in schools. In Australia, we're seeing more infections in schools because this variant is more infectious in everybody.
You talked about during an outbreak, at 80% vaccination, you have about 1,300 deaths within 180 days, for example, and a few deaths of children in that sort of scenario as well.
Yeah, so that wasn't our final optimal strategy. So that was in a situation where case numbers escalated and the public health response couldn't quite keep up. And what we actually ended up recommending and what was in our addendum report was a situation where if the population can accept some ongoing degree of social restrictions and some workplace caps and other things, and all of these nuances are being worked out, but with the expectation that life will not be exactly normal and that we're not launching into Freedom Day, that we can still reduce that burden further and accept the reality that COVID is in our world.
Well, speaking of which, Mark McGowan had some interesting comments to me last week around that. He said he could still shut state borders. He still after 80% vaccination, and he wanted to pursue zero COVID still. What did you make of that?
I think that will be a very challenging strategy to pursue into the future. We have seen how contagious this virus is. We've seen how difficult it is to keep out. And in jurisdictions that have had highly effective public health responses and contained outbreaks, it has been getting away. I mean, this is the scenario in New South Wales right now. So I think it is really important for the population to understand what we're dealing with and to be realistic about what we're facing moving forward. I'm not here as a prophet of doom. I'm a prophet of hope. I think we should be, incredibly I'm incredibly grateful that we have vaccines at this point in time. I never believed it was possible, but that's really what makes it a reality for Australia to be able to move forward, to be able to re-engage with the world, and to be able to turn what's been a terrifying, catastrophic infection in so many parts of the world into one of the infectious diseases that we live with in an ongoing way.
Jodie McVernon, thanks so much for your time.
Thank you.